The MUST trial is designed to have a standard thrombolytic treatment with thrombolysis with urokinase or RTPA, but we added for the first hour of the thrombolysis therapy microbubbles to it. And microbubbles could enhance the thrombolytic therapy because they have special features. These microbubbles are 1 to 10 micrometer bubbles filled with gas and a lipid shell, and they oscillate when subjected to ultrasound, so they can make the thrombus more susceptible to thrombolytic therapy. The advantages from ultrasound thrombolysis is actually that the ultrasound can give ultrasound waves that make the thrombus more susceptible to the thrombolytic therapy. However, adding microbubbles to it, it's even better because these microbubbles will oscillate when they are subjected to a low-intensity ultrasound, and they can cavitate when subjected to high-intensity ultrasound. And because of their mechanical effects of these microbubbles when subjected to ultrasound, they can make the thrombus more susceptible to thrombolytic therapy, but also break the fibrin strands. And it's a very delicate procedure, so it's not mechanical like an arterial thrombectomy or something, but it's really a very fine and subtle way to enhance the thrombolytic treatment. So these microbubbles not only oscillate or cavitate when subjected to ultrasound, they have also other features. They can also carry thrombolytics to the thrombus itself. So that means actually you can design microbubbles by yourself and put thrombolytic therapy inside the microbubble or on the lipid shell. And then you don't need a catheter at all. You just put them intravenously, and then they will give the thrombolytic therapy on the site where the ultrasound is active. So when you apply the ultrasound on the femoral popliteal area, then the microbubbles will be exploding or cavitate or oscillate on that area. And when they carry the thrombolytics with them, they will also carry the thrombolytics to the site of the thrombus, which is a next feature of microbubbles itself. And future therapeutic options are even that you can make them even smaller, to nanobubbles. And nanobubbles are 5 to 500 nanometer, and then they can even go through the endothelial barrier without destroying or damaging the endothelial barrier. So they can even go to deep tissue and treat other treatments, not even thrombolytic therapy, but other options for treatment as well. To further update on this trial, because there has a lot been happened between November and right now, is that we now included more patients with alteplase therapy combined with microbubbles, and we see that we can achieve thrombolysis within 6 hours, which is actually really fast and a subtle way. What we also see is when we put the microbubbles in the patient and we look on the ultrasound and we look on the screen, we can see that the thrombus is magically disappearing or something. They are dissolving within the side of our eye, and that is something very, very new and I think groundbreaking. So the main goal right now is just to finish the trial as soon as possible, because this is a feasibility and safety trial, and this is just extra finding that it's working this well. So the next trial will probably be a very large study with the microbubbles and alteplase, and to see if we could see the same effect in a larger cohort of patients. In our next line of future research studies after this feasibility and safety trial, the MUST-2 trial is this, we will start a next trial that we will observe the effects of microbubbles enhance the thrombolysis therapy in a larger cohort of patients. It might be randomized, it might be not, because it has been such a good effect that we now see that we can see that thrombolysis has been reached within 6 hours, and we don't want to maybe randomize patients then, because it might be that effective that it might be not good enough to, to say to patients that you don't get microbubbles treatment. Well, we know that we can enhance the thrombolytic therapy and shorten the duration of treatment. So we have to discuss that with the ethical commission to see if we want to do a randomized trial or just a very large cohort study to study the effect of microbubbles in patients further. And the next trials also will be in diabetic foot healing. We will try to add the microbubbles because they oscillate, like I said, actually when they're subjected to ultrasound, they oscillate, and we think that they even can enhance wound healing. So our next trial will also be in diabetic foot wound patients.